Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina Callion, the #1 Nclex instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass Nclex. Hey there, welcome to our favorite time of the week. Welcome to our favorite time of the week. This is 1, 2, 3. We call this How to Pass Nclex. And I'm here, your #1 Nclex instructor, Surge Nursing. You know, I have been on this for a long time. Med Surge and Nclex questions coming right up at you. Virtual Trainer is the sponsored provider of Monday How to Pass Nclex. Also, our Monday motivation as well. If you don't have your virtual trainer, let me tell you, you're missing out. You're missing out. All right. It is my favorite program that I've ever created, ever in life. And I know you guys will love it. We have a wonderful community here at Remar. 6,700 nurses are studying in the virtual trainer. Yeah, 6,700 nurses, and you community. I want you guys to be a part of it. If it's your first time joining us, you made it to the live session. Welcome. If you're watching on the replay, let me tell you something. We did endocrine review. Did you catch it? It was live. If you missed it, if you missed the endocrine review from the virtual trainer that was live this week, there's only one way I think you could have missed it. There's only one way you could have missed it, and for me, that way is because you have not liked or subscribed to our Facebook page or our YouTube channel. So please make sure that you do that, as well as share the video, because whenever I pop up, you guys know I pop up and I do these reviews. I don't want you to miss any of the important things that I'm sharing. So like, subscribe, share the video so that you don't miss anything. We are going to are you guys ready for your Nclex questions? We're going to get right into it today. I have some challenging Nclex questions. Remember, we come together. This is our opportunity to just kind of test what we know. We check the foundation. We check the foundation of what we've been studying, and then we go over the answers together. What I'm finding for students who are failing Nclex is basically the same thing. We're confident we're confident in our foundation, and we think we have understanding on a subject, but we don't. Let me tell you something. Just because you hear me say something, that does not mean that you understand it. All right. So when we're going through these questions, it's not so much about hearing and saying, oh yeah, that's right. It's more about, do I already know this information, or it is me hearing it a reminder that I don't know it. All right. So we're going to do our first question today, and it is this. Says the practical, and I'll answer you guys. See your questions. I'll answer your questions at the end of this too. All right. The practical nurse is instructing the parents of a 7-month-old child with human immunodeficiency virus regarding to the inactivated influenza vaccine. The inactivated influenza vaccine should be given each season. 3, the child should receive the oral polio vaccine before starting daycare. Or 4, the varicella vaccine should be administered at 12 months. Okay, this is what we're talking about. All right. Practical nurse is instructing the parents of a 7-month-old child with HIV. All right. I'm so proud of you guys. You show up here and you make me so happy when I see everybody picking the right answers. Good job. We're talking about building on a foundation. And you guys have a great foundation. Good job, guys. All right, I'm going to show the right answer. The correct answer is actually going to be number 2. Excellent, Remar nurses. today. The inactivated influenza vaccine should be given each season. Yes, 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 yes. So this is recommended for every child. This is recommended for every child 6 months and up, right? And it doesn't matter if you are exposed to HIV, you should get it. This virus is not live and it is beneficial. All right. So let's look at the other options just really quickly as a review. And you guys can study. Remember, you can study immunizations in your quick facts, the 5-star quick facts for Nclex, if you have it as well as a follow-up to this question. Okay. All right. So number one, hepatitis B is safe to give, whether you have HIV or not as a child. And you should know when that medication is, when that immunization is administered. Number 3 says oral polio vaccine. Remember, oral polio is a live vaccine. So we're not going to give that. Yes, Katie, we're not going to give that. And then the varicella vaccine is also live. So the correct answer is number 2. And for those reasons that we talked about, okay? All right, let's roll on to the next one. Oh, I like this question. Okay, here's the next question. Question number 2. Shout out to the virtual trainer helping me today. Which of the following clients is most at risk for postpartum hemorrhage? What does that mean? All right, is it number 1, a 5-pound, 11-ounce infant after a 12-hour labor? A 7-pound, 2-ounce infant after a 2-hour labor? A 6-pound, 4-ounce infant after an 11-hour labor? Or an 8-pound, 6-ounce infant after a 9-hour labor? Take your time. Look at this one here. Which of the following clients? Yeah. Okay. What do you guys think? I see a variation of answers coming in. And I'm okay with that. I like it because this is what we're here to do. We're here to critically think and study. But when I show you guys the answer, it's going to be super obvious. You'll be happy about it. Hey, everybody, you're live for the Monday How to Pass Nclex class. I welcome you here. I'm so glad that you made it. I'm excited to see everybody together. A lot of people are picking number 1. A lot of people are picking number 4. Some people are picking number 2. Which one is the correct answer, though? And some people are between answers. I see you. Shout out. I know I got Boston in the house representing as always. All right. Remar nurses, we are live. And the correct answer, y'all ready for the answer? I think you are. Okay, a lot of different kind of babies here, all different sizes. Oh, how do I know who is most at risk for postpartum hemorrhage? All right, back at it again, Remar nurses. The correct answer is yes, it's number 2. It's number 2, not based on postpartum hemorrhage, not based on the baby's weight, but based on what? A fast labor and delivery can cause those uterine muscles to be exhausted. All right, which means that after the delivery, they're not going to be able to contract like they should. So that puts the patient at risk for bleeding. Yeah, so specifically, look at the time difference between, did you get this one right? Look at the time difference between the other option. You got a 12-hour labor. That's a long labor, right? 11 hours, 9 hours. All right, so your body is going to be able to adjust and recover a little bit. But 2 hours, I mean, that's going through all the transitions, right? And so that is why, even though the baby's weight is not very big, 7 pounds, 7 pounds is quite big, actually. But it's not It's not about the baby's weight here. It's about the fast labor. And if you didn't get it right, guess what? When you see it on your Nclex exam, you will get it right that time. And so that's why you come here. You come here to contribute to this community. All right. You're a big part of it. I'm not doing all the work. You guys are doing all the work. I just get to read. Like question number 3. Here we go. After a lumbar puncture to obtain a specimen for meningitis, a client develops an irregular pulse, bradycardia, hypertension, and dilated pupils. The client also reports a headache. Which ordered pharmacological intervention is the highest priority for the nurse to administer? Okay. All right. Here we go. Number 1, epinephrine to increase heart rate and cardiac function. 2, oxygen to increase tissue perfusion. 3, dexamethasone to decrease intracranial pressure. Or 4, morphine to relieve pain. All right, it's time to show up right now. Question number 3 is a divider. Either you have a strong foundation or you're weak in this area. Essentially, what are we talking about here? What do you have going on? You have a patient, possible what? Possible meningitis, but they're getting a lumbar puncture, so we don't know. Do you know if they have meningitis or not? Not sure. But you do know that they have all of these issues after this lumbar puncture. What is going on? Goodness. Patient bradycardia, patient irregular pulse, patient dilated pupils, patient headache. What is the pharmacological intervention that is this is safety. This is safety, safety, safety. You got to get this right. Nclex can come at you all different types of ways. All right. And so here, this is definitely a pharmacy question. However, the pharmacy is connected to a diagnostic procedure. Oh, I love it. I love it. Okay. All right. I'm going to reveal the answers. There's a divide. There's a divide in between what people are picking, and that's okay. All right. Because I put this on here for a reason. But before I reveal the answer, because some of you guys, you might want to change your answer. I have your, I'm looking for it here, just generally. If you guys have the virtual trainer, actually, it is actually the very first diagnostic procedure that we go over, because there are so many questions that can be written based off of the lumbar puncture. All right. So make sure that you have, make sure that you go over this. So the correct answer, let me see. The correct answer, remember, the choices were epi, the choices were oxygen, the choices were dexamethasone, or the choices were morphine. Okay. The correct answer actually is number 3. The correct answer is number 3. This is a situation where oxygen is not the priority here. This is a situation where oxygen is not the priority, because what is this patient having? What is this patient having in a response to this lumbar puncture, right? This patient is having increased intracranial pressure, okay? Increased intracranial pressure. And because this patient, and these are actually, you know what, guys, these are actually very late signs of increased intracranial pressure. So this patient has been dealing with this for some time, and it hasn't gone checked, all right? It hasn't gone checked. So we have to do something about it. We have to do something about it. So number three, you are going to have to give a steroid. You're going to have to give a steroid like dexamethasone. And if you got it right, great job. You were able to recognize that this is not always a case where it's about oxygen. So also, if you have your quick facts for Nclex, increased intracranial pressure is in here as well in the 5-star. And I give you guys a list of medications that you're going to give for a patient with increased intracranial pressure. Those medications are anticonvulsants, blood pressure medications, corticosteroids, and diuretics here. So this again, look, these two together, the winning combination. All right, you're gonna get that foundational stuff. So then when you see this, you're gonna say, I know oxygen is good, and I know that oxygen is most likely a priority, but not here, not all the time. Okay, so this was a tricky one, but I got to keep going. All right, so here we go. Next one. Question number 4. Which client incident would be considered a Sentinel event? All right, so Sentinel, same. A newborn getting discharged. All right. A client who receives 1 hour late. All right. 3. A client who falls from the bed and requires a head CT for potential bleeding. 4. A client who does not receive a scheduled wound dressing change. Or 5, a client who refuses to take a required blood pressure medication. All right, what do we have here? Okay. All right. Select all that apply as one or more options can be correct. Which of the following would be a Sentinel event? All right. I see the answers going. Come on in. If it's your first time, we're just going over an Nclex question here. A lot of people are saying 1 and 3. Okay. All right. 1 for sure. All right. Let's review 1, 3, and 4. I see it. Let's review Sentinel events. We talk about them in the virtual trainer. But for those of you who don't have it, you might like to know this information. All right. So typically a Sentinel event is something that causes undue harm, unexpected harm to a very high level of a client, right? So, for example, death, right? If there is an injury or a risk that is totally unexpected, unrelated to the person's diagnosis. So we have here loss of a limb or function, suicide, rape, infant death, infant discharge to the wrong parents, right? Because can you imagine, we're talking about psychological harm, right? Surgery on the wrong body part or on the wrong patient. And so these Sentinel events have been tracked by Joint Commission. They've been reviewed, and they happen. And I don't know, you guys in your own community might, there might be this hospital, like, so there's like certain hospitals that most people don't want to go to because it is complicated. And, and it's like things that you hear like rumors, but no, these things actually happen. These Sentinel events actually happen. So for Nclex, it's a very, very important subject to know. And so here, the correct answers were 1 and 3. 1 and 3 would be considered Sentinel events. All right. Good job. A lot of people got that one right. Congratulations, Remar nurses. You are doing excellent, excellent, excellent. All right. Let's do another one. I'm switching it up here. We're doing all topics today. So I hope you guys are enjoying the variety of the questions that you're seeing on this day. All right. Question number 5 is this. Here we go. A client in a semi-private room is scheduled for open heart surgery. Mm-hmm. He informs the nurse that church members will be coming to pray with him before the procedure. 10 people arrive singing loudly and clapping in the client's room. Which is the best response by the nurse? Number 1, move the client's roommate to a temporary private room. 2, inform the client's visitors that they can continue to sing, but in a lower volume. 3, allow the visitors and client to continue to meet their spiritual needs without interruption. Or 4, organize the client and visitors in the hospital chapel during the visit. This is a great question. This is a great question because, all right, this is a great question. And listen, if you saw it in the question bank, don't even answer it. All right, don't even answer it. Don't cheat. Let everybody think for themselves. You guys know how important cultural competence is and spirituality is for clients, okay? And Nclex is huge. Nclex is huge on making sure that you, as the nurse, do not infringe upon your patient's preferred spiritual practices, spiritual or religious practices. You have to find a way around what they want to do. All right. All right. So with that being said, what is going on here? What's the best thing? I see a lot of answers. I see 2s and 3s and 4s. Not too many people pick number 1. Not too many people pick number 1. Okay. And I love this question because a lot of you probably have not ever been in this situation before. And so that's what Nclex is going to do to you. All right. Yeah. That's what Nclex is going to do. They're going to put you in situations you've never been in before. So I'm happy that you guys are here. Okay. So I'm going to reveal, am I going to reveal the right answer? Yeah, I'm going to reveal the right answer right now. Okay. And the right answer for this very tricky, very sticky situation is It's number 4. It is number 4. The nurse needs to organize. The nurse needs to organize these visitors in the hospital chapel because even though it is the client's religious preference, this is a semi-private room, okay? So number 1 says, number 1 is not correct. Not too many people pick this, but it's not correct because taking a client out of the room violates their right for privacy, okay? They should not have to move. A patient that was assigned to a room should not have to move because their roommate has visitors. That's not okay, all right? So we cannot infringe upon somebody's rights and say, hey, let's get your stuff and we're going to move you. No. All right. 2, inform the visitors that they can continue to sing, but in a lower volume. Okay. No, well, if there's an option to have a chapel, then there's a chapel. Okay. All right. So, inform the client's visitors that they can continue to sing, but in a lower volume. Nope. Not cool. This is a semi-private room. That 10 people, too many people. That's too many visitors. All right, it's just too many visitors for a semi-private room. All right, and then 3, allow the visitors and client to continue to meet their spiritual needs without interruption. A lot of people pick this because it sounds good. However, you have to recognize that there's another person in the room. There's another person in that room that you have a right and a responsibility to advocate for. Okay. So if they're singing and clapping loudly, we don't know if the roommate is the same denomination. We don't know if the roommate is enjoying this or if they're getting anything beneficial. Okay, for both of her patients at the same time, we need to move this patient to the chapel. And remember, if it's an option there on Nclex, it's a viable option. They're not going to have an option to move somebody to a place that doesn't exist. All right. So there is a chapel there. Let's get those patients. Let's get that patient and their visitors down there. And then they can sing and have worship because that's an appropriate place to do it. All right. So how did we do for that one? Does that make sense for everybody? All right. Does that make sense for everybody? Okay. All right. All right. Here we go. So, if you want more questions, hey, it's a possibility now. You guys know we have the question bank now, the remarnurse.com Nclex question bank. Check it out there. I got these spiritual questions, the med surge questions, all from that resource. I pull from them to do our Monday sessions now. And it's so much easier for me just to do it that way. And the prices are great. We got 30-day subscription plus 100 question assessment for $29. We also have a 60-day subscription, $49. And also the 90-day subscription for those of you who like take your time. And it comes with 2 100 question assessments, all over 1,200 questions. And I am just so happy because we have another 500 slots available for the question bank. You guys know we were exclusively selling it privately. We have been metering down the exclusivity, and we're excited for you guys to get in and get the questions done, and also give me your feedback. I appreciate it. Now, let me just surprise you. I love to have new things happening. And so I definitely will have a major announcement coming up for you guys. So stay tuned. But we got to do our motivation. So it's time for some Remar nurses who passed Nclex to get your Remar nurses, your Remar roses, the blue, beautiful roses. It means you passed your Nclex exam. So our first congratulations. And I know we had some people pop on and say that they passed. Like Nurse Julia says she passed June 23rd. She's a proud Remar nurse. We also have Nurse Sess. If you guys didn't see her testimonial, amazing. She shared it with us on social media, Facebook. I can't keep calm. I passed my Nclex RN. Sess Kabayan, all right, representing for her countrymen, Philippines. Love it. We also have another international nurse, Vanessa Fletcher. She says, thank you, Remar. I'll be posting about my Nclex journey later. 12 years out of school, international nurse representing. What flag is that? Somebody tell me. I can't. Which flag is that? All right. Is that the Philippine flag as well? I can't see it. Let me see. Yeah, it is. Okay. All right. Nurse Vanessa Kabayan. All right. Shout out to all the nurses that are passing. We also have Nurse Shoshana, who passed her Nclex. You guys are going to be next. Congratulate these nurses because you guys are going to be next. I know it. That's why you come here. That's why you show up. Nurse Jessica shared her success. Nurse Jessica, thank you guys so much for helping me with that flag. Nurse Jessica shared her success, and I'm just so happy to see her. I love the traditional hats. Don't you guys love the traditional hats? So miss the live classes so much. I miss it so much. I miss the traveling. I miss the locations. New York always shows out. I love the energy there. But Nurse Alston, she passed her Nclex exam, sent me a photo and said, hey, remember, we should be celebrating. We should be celebrating that test date. You chose it. It's yours. It's yours, okay? So I want to celebrate that with you. And listen, when I say celebrate it secretly, because telling people will just make you anxious. They'll be saying, oh, you take Nclex in 5 days, or you take Nclex next week. Don't go through that. But be happy when the day comes, okay? All right. Okay, what else? Oh, don't rush the process. Yes. So the VT in the question bank, don't rush the process. I know some people want to, they want to go through the VT in a week or two. Don't do that. Listen, if it take you longer, it take you longer. If you need to renew it for another 30 days, do that. You can do that. It's the same thing with the question bank. Hey, you need to renew longer than the 60 days or the 30 days. Just renew your question bank. Don't try to rush the process. Don't try to interrupt the process. Just trust the process. Trust the process. And so that's what I need you guys to do for sure. All right. And so pass Nclex if you don't have the VT or the question bank. You can get it at readmarnurse.com. Again, that's the best way to connect with me. Listen, guys, my time is drawing near. Okay. My time is drawing near. I'm going to be leaving soon. All right. You guys know this. Shiloh is coming. Shiloh is coming. And some people are like, who's Shiloh? Does anybody know who Shiloh is? Who is Shiloh? All right. Who is Shiloh in Mark? Not from a biblical standpoint, but just from a very common standpoint. Does anybody know who Shiloh is? Because she's coming. All right. She's coming. And so when she comes, like very shortly, you won't see me for a while, but you will see her. Isn't that what Christ said? So yeah, Shiloh's coming. The baby is coming. So that means that, and so is my maternity leave. All right. So is my maternity leave, guys. And so for that reason, you got to get it while it's good. And you got to get this while you can. All right. So here it is. And I see you guys. So to celebrate that, we're going to do something big. We're absolutely going to do something big. So we're going to have a major announcement during my baby shower. So I'm doing a virtual baby shower review. And it's a virtual baby shower and it's a virtual Nclex review. Okay. So if you have not signed up for that, it is going to be next Monday at the same time that we do Monday Motivation. This will be my last event. All right. So it's the baby shower and it is also the Nclex review on maternity. So there's a workbook. Make sure you sign up for that. You can sign up for it on the Remar Facebook page. Okay. And also, I think we're going to stream it on YouTube as well. So it should be on YouTube as well. Now, I am going to do something huge. I know what you guys were asking me about the VT, but you guys really showed out purchasing stuff from the registry. You guys really showed out. And I'm going to answer your questions. I see them in a minute, but I have to say this. Shiloh has gotten so many gifts from the Remar community, like the YouTube family. You guys have both things. Like we had so many people buy like 4 and 5 things off of the registry. I just cannot thank you enough. So Mark and I are going to do something crazy. So what I want to say is if you haven't gotten the VT, just wait until next week. All right. And that's all I'm going to say about it. But we literally have almost everything that we need for this baby because of you guys. You just been blessing us tremendously. So Mark and I want to do something special. When I go out on maternity leave, I will not be doing lives in this way. I probably will do some things from inside of the virtual trainer. I have a couple more presentations that I want to get to, but I'll do them inside of the virtual trainer. So I'll go live inside of the virtual trainer and I'll just try to do as much as I can. So my maternity leave will be, I'll be taking all of September off and probably into October. Okay. So with that being said, don't miss next week's Monday event. It will be the last event that I'll do in the live format in that way. And also don't forget to like and subscribe to the channel, because if I do go live, I don't want you guys to miss it. So for you guys who missed the endocrine review that I did, you're still able to see that. I think it's on YouTube. You can check it out on YouTube there. So you're able to do that. Okay, I'm gonna take questions. I'm gonna take questions for a couple minutes now. So if you have general questions that you want to know. All right, so here we go. The support team will still be available. Everybody will still be available. All right. Will the VT go back on sale? Yeah, wait till next week. Okay, just wait. Just wait. All right. Can you please put VT back on sale before Shiloh comes? Please. Yes, put it up on. I'm going to put the virtual baby shower on YouTube. Somebody said I don't do Facebook. All right. I got you. All right. The support team will still be available to you. Mark might even come on here and do a Monday motivation. I don't know. Definitely. How do we view you live in VT? Okay, so if I go live in Virtual Trainer, which I plan to do, I'll actually create an event, and it will literally say Regina Callion is going live on Wednesday at 6 p.m. So everybody in the Virtual Trainer will get that announcement. All right, and you will be able to just watch it inside of your Virtual Trainer. So when you log on, you'll see me. It'll be a live video. Okay. Let's see what else. Let me look. I'm switching over to Facebook right now. Somebody says, I have the VT. I was asking for the maternity workbook. Okay, so the maternity workbook, it's not done. It's not done being edited yet. I did turn it in, so we're supposed to be sending it out. I'm gonna put it as a file in the Facebook events group, so you'll be able to get it from there. And then also, I don't know if Mark is going to email it out as well. I'm not sure, but I'm putting everything in that Facebook events. So I think we have like 700 or 800 people interested in that. So I'll put it there. Okay. I have, let me see. In the question bank, I'm getting mostly 60s. Is that passing? Yes. Well, what I'm going to say about that is in your question bank, everybody's score will be different because the question bank is supposed to assess your personal knowledge. So it really depends on what kind of questions you're putting together. If you're mixing different subjects, if you're doing math and you're doing, fundamentals and you're doing mental health and you're mixing those questions together and getting a 60%, that shows that you have, half of the competency, right? You have a great baseline where you can get half of them right, half of them wrong. Remember, that's what your performance will reflect on your actual Nclex exam. You're going to get about half of them right and half of them wrong. All right. But everybody should be trying to get the highest scores possible. So if you're getting 60% of the questions right, then that's great, right? That you can be happy with that. But would you be happier if you were getting 80% right or 90% right? And so really you have to make that determination of how comfortable and how confident do you want to be. All right. Is there anything new about testing sites? There is nothing new about testing sites that I know of. I'm not hearing of any more opening up. The date is still September the 30th. They have not extended that date at all. So I don't have any new information. There has not been any new information of any changes. Okay. Let's see here. Do you suggest doing 130 questions daily? No, I don't. Nope, I don't, because what I'll say is that I don't want to put a limit on how many questions a person should do. So if you can only do 30 questions a day, then do 30 questions a day. If you can do 130 questions a day from the question bank and have some level of retainment of the information, and you can memorize, facts and things that you should know, then that's great. But I don't have a certain number of questions. I was in the question bank yesterday. I spent quite a while in the question bank just reviewing questions, and I think I only did about 40 questions. So that was just me on a Sunday. All right. So everybody's going to be different. If you purchase the question bank, how do you get to the questions? So there's a link that will take you directly to the questions. If you email support@Remar Review or Facebook the team, they will send you that direct link. Okay. All right. Because it's not inside of the VT. VT is usually 3 hours. Yes, if you follow the calendar for the VT, it is about 3 hours worth of work. And that's what I say our study session should be, about 3 hours long. Okay. If someone fails with the VT, how do they bounce back? That's a great question. So if you fail with the virtual trainer, you have to ask yourself questions reflecting your Nclex performance. So when somebody tells me that they failed Nclex, one of the first questions I ask them is, how did you feel during your exam? Not even what did you study at first, but just how did you feel during your exam? Did you feel like, number one, you recognized the information and you were unsure of your choices? Or did you feel like the information was another language, like you had no idea what the information was even talking about? All right. Because that puts you into one or two groups immediately. Like either you have a strong content knowledge, but maybe your reading comprehension was off, or you have content knowledge, but if it's put in front of you with distractors, you can't recognize it. Right. So you're either in that group where your content is it's there, but there's layers on top of it that prohibit you from finding the right answer. Or you're in another group where you failed at the minimum. You got the 60 questions, or before that, you got the 75 questions or whatever, and you just didn't know it. So really, pretty much anybody that's failing with the minimum questions, and Nclex doesn't even have to make they don't even have to expose you to a lot of questions to know that you're going to fail. They figure out right away. Then you have a content knowledge question. And so you can go back to the virtual trainer and you can go back to your book. Go back to your book and just see if you did your due diligence with it. So if you go back to your virtual trainer book and you look at it, did you just fill it out blankly? Like, did you just fill it out? Or did you really go deep into it? Do you have like definitions? I love when I see students with highlights and definitions and circles and erasing. Did you really work the book? Because this is a workbook. And so you can just fill it out for answers, and, while I'm lecturing, you're like writing things down, or you can really work it, and dig deeper into the information. And so I would start there. Also, I can't neglect quick facts too. You have to be honest with yourself. Did you have everything in this book memorized? Did you wish you had more time to review it? Because a lot of the content, a lot of foundational material comes from this. All right. So that's what I would say. Do an honest self-reflection and self-assessment of where you were, how you felt. Did you let anxiety get the best of you? Did you let anxiety get the best of you during your exam? So you were there, but your mind was thinking about something else. Your heart was racing. You weren't calm. You didn't take the break that you thought you should have took. All of these little things go into your Nclex experience. All of these little things, right? And so when you fail Nclex, it's a very complicated situation, because you literally have to start over from the beginning, deconstruct your whole process, and figure out where you could have done better, where you got lost, where you got off track. Okay. All right. And so if you need the Nclex grief form, that helps process, that deconstruction. And so email support@remarreview.com and we can get you out that Nclex grief form. Okay. All right. What else do we have here? Nope. So if you want to sign up for next week's event, you can do that right on Facebook. Okay. Somebody says, my first attempt, my anxiety got the best of me. Yeah. Yep. Can't ever, you cannot ever ignore anxiety because it will. All right. That's it. Okay. So that's it. All right. I keep getting to week 4 and then starting all over from the beginning. Get past that week 4. Get past the week 4. If you feel like you get to a certain place, that I feel like that is a sabotage technique. Go past it and then go back if you want to go back after that. But keep making forward progress. Every day you should be building on the last thing you studied. You should be making steps forward. If you're in the question bank, yes, you get the rationales with the question bank, but definitely make sure that if it's a subject that you're not familiar with, you spend some time on it. All right. So yep. I look forward to seeing you guys next week. I'm excited about it. We have a huge announcement. We have a huge giveaway. So make sure you show up for that event. It's going to be live next Monday. All right. And if nothing else, thank you so much. You guys did a really great job with those Nclex questions today. I got them from the question bank, the virtual trainer question bank. So if you like them, you can continue studying there with those types of questions. We always end by saying, I can, I will, and I must pass Nclex. All right, guys. Bye-bye.